So we have Neil Baker with us. He's been here before, but he's back. And the reason that he's back is because he has been diligently following aspects of the COVID virus, not so much the treatments or virus vaccines, but more some of the sociological and community-minded things, which makes sense because although Neil is a doctor, he works in organizational and leadership fields of medicine. And so I imagine that this kind of cultural issue is of great interest to him. So thank you, Neil, for joining us. And as you've said before, you don't have all the answers, but you have been collecting questions.
Yes. Well, great to be here with all of you. I would say just to give you a little background on myself, I've been on the island for 28 years, and I live with a partner. We've been together 14 years. She has daughter, son-in-law, and grandchildren on the island, and I have a son in LA, and also a son, daughter-in-law, and two grandchildren in Seattle. The grandchildren on all sides are anywhere from 3 to 9, so they're still pretty young. While my background is in medicine, I am not here as an expert. I'm not an expert in public health or infectious disease or epidemiology. And so I'm just presenting what I've done in terms of struggling with the question of when do you get together with people? How do you get together with people? How do you talk to people about all this stuff about social distancing if you want to bring people into a bubble? I don't know if you've heard that term, but I'll talk about that. So this is what I've been struggling with. So I'll talk about how I've approached this, but this is, as Reed says, wide open to, I'm interested in learning from you too about where you may disagree, have different opinions or validating opinions or elaborations, whatever. So one of the ways this came about is Kitsap for a long time and even King County, not as much as Kitsap, had relatively lower levels of transmission. And so we were getting questions. The question we had spontaneously and from our children is, when do we open up and get together more? And how do we treat all these social distancing rules together? And so I've been researching and I just have been, that's my sort of, with anything that comes up, I tend to like this. I tend to do a lot of research and thinking about it. And because that's just my way of trying to understand and grasp something. And this has been particularly hard to grasp. So I'll walk you through conclusions. My current ways of thinking about this and what we've done. I do want to say one area I have a fair amount of expertise in over a 30 or 40-year career is around human behavior in organizations and in different contexts and how we change habits of behavior. So I've brought that to this area. And what I'll just give the definition of when I think of a bubble, it's borrowed from, it didn't originate in New Zealand, but New Zealand really was able to crush the incidence of the virus and really use the concept nationally of bubble, where a bubble is all those people with whom you don't socially distance. So the smallest bubble is your household. And as they've gone through stages of opening, and incidentally, they didn't open anything until the virus there were near zero transmissions for 2 weeks. This is zero. This is not a certain number per 100,000. Zero total transmissions in the country. And then they opened up, well, add 5 people to your bubble. Well, then how do you add people to your bubble? Well, people in the bubble should, there should be an agreement on what that means. And I'll tell you more about how we went about this, but I find these conversations inherently awkward because it's so easy to come across as judging somebody or not trusting somebody. And that's where I brought my experience with behavior and habit change. We are in a situation where our automatic habits of behavior are no longer relevant socially. We've got to adopt new ones. And
Yeah, I just think about right off the bat, Neil, the idea of shaking hands
yeah,
as an expression of welcome and connection. And it's like right off the bat, that is one of the first things we were told, don't ever do.
yeah. Well, the other thing is when you get together with somebody, if you've known somebody for a while, they're a family member, and if you're wearing a mask or needing to stay 6 feet, do you not trust them? Well, I hear when I've talked to people in our families, a lot of the starting place is, well, I trust you, so X, Y, and Z. Well, when it comes to behavioral things, in my experience is this is not a matter of trust or how long you've known somebody or how trustworthy somebody is. Changing habits of behavior is hard. We all make mistakes. I've certainly made mistakes, and I can tell you about some. And there's the other problem in making these changes of behavior is that we do not live in a social and political environment that is supportive or unified. So it makes it much, much harder to do that. So to open up these conversations. So to even have these conversations, I'll carry through a logic chain I've had with this. And the first question I have to go back to is, how worried am I about getting this virus or transmitting it to somebody else? Because it's so easy to lose track of it. We look around, it's a sunny day, everybody's walking around. Well, they have masks and stuff, but for a while they didn't. Everything looks normal until you read about what's going on in certain hospital emergency rooms and intensive care units and look at some of the statistics. So I find it it's easy to let down one's guard and do things. About 2 months ago, for example, or was it not? Maybe it was just a month ago. I ordered some stuff online from Ace, and I thought I was going to pick it up at the curb. So I drove to the curb. I had my mask on and stuff. Nobody was there. So I went in the store, and that Ace here on the island is not a big space like a TNC or even Safeway. Ceiling's lower. It's much more confined. So there were 30 people in there or so, 2/3 of them without masks. There was a woman who was helping, who was standing this close to people without a mask. And I didn't just get out of there. If I believe what I'm going to tell you, I believe what I do. I should have left and called them. I stayed there for about 15 or 20 minutes and got my stuff, but I consider that by my own personal guidelines, a mistake. That I've exposed myself to that. So in that situation, it's because the biggest problem is indoors, less ventilation, no masks. It's like, that's the worst situation. So the first question is reminding myself, do I really want to get this or give it to others? And my answer is no way. This is highly contagious. It's easy to give it to others. Second, or get it. The second thing is, even in people who are young and healthy, there's a very uncomfortably high incidence so far of long-term effects in the brain, the heart, the kidneys, and the general malaise and things. We don't know, I think, the percentage of this yet, but there are literally thousands of people in these online groups now. So kids have gotten it and died. It looks rare, but we can't absolutely say for certain. And then if you're older, the risks of death are much higher. So I don't want to get this or give it to anybody.
Now, you said online groups. Are you talking about groups that are
support groups for people who have long-term side effects?
Thank you.
The next thing I go to is, what is the environment we're in? It helps me to remember this is the most awful, in my opinion, the most awful social and political environment for sustaining a group behavioral change that can be thought of. This is just very bad because it takes solidarity to do this. Incidentally, and so I tended to look at, what do we know about? That's one thing about how the virus is managed. how do I know the community transmission levels and and how does that affect my decision making? So I'm going to share my screen to show you what I worked on here. What I tend to follow the work of a organization called End Coronavirus. It was started by Nassim Taleb, who is of Black Swan fame, and Yanir Bar-Yam, who wrote a paper in January before any of this started, who predicted all of this. And the optimal goal is 0 or near 0 new cases per day. And at least 45 countries have gotten to this. And the reason for this is, and they go over this using mathematics I frankly don't quite understand. But what happens is, even if you get a few cases, there's a risk of an exponential increase that's out of sight, particularly if you don't have adequate contact tracing and testing, which we do not. The next best goal I've read, and this is from Michael Osterholm, who's the director of the Center for Infectious Disease Research and Policy, is 1 to 2 cases per 100,000. Both of these goals sustained for 14 days and adequate testing and tracing to meet goal. We don't have that in our country. In Washington State, I follow a website, Test and Trace, that shows that we're not meeting the goal for the positive rate. If you see right here, which is the goal is less than 3%, the positive rate is 5.2%. And you need about 5 to 15 contact tracers per positive test, and we're at 2.66. So this graph shows in green the optimal goal, the window of 1 to 2 at the bottom in red, cases per 100,000. And you can see this is a daily rate. You see some of these graphs where they average it over 7 days. In any kind of phenomenon, there's a bouncing up and down. The 7-day graphs will smooth this out. I prefer to see the actual number, and then Excel puts in a trend line here. So you can see I was a little bit more comfortable going out. This is the last 2 weeks when we were bouncing around within these red lines for a month or two, and now we're above it. So I'm less comfortable. So it reminds me to keep my guard up, but there's no hard and fast rules. This is King County. You can say they've not been near goal, and they're bouncing around above goal. So
so this is in a way a warning that we actually are. If we looked at where we were in March, when we were all first alarmed by this and we shut everything down, we're in a worse situation in terms of risk right now than we were then.
Yeah, Kitsap was never in the 1 to 2, was bouncing around within the 1 to 2 per 100,000 range. And the reason I like the goal of 0, besides the fact that makes sense to me, is that I don't grasp the numbers 1 to 100,000, 2 per. What does that mean? I like hard number. 0 is a goal I can live with. And as I said, there have been about 45 countries have hit this. New Zealand, and these are countries who are not just island nations like New Zealand, countries in Europe, Asian countries. So it's a variety of situations. I suspect that our hot and sunny days. Yesterday, I came back from the ferry, and there were tons of people coming in. That tourism. One of the things they talk about in endcoronavirus.org is maintaining what they call a green zone, where you really restrict travel between if there are neighboring areas that are hot with the virus. Then here's the way I think of talking about people. This is from 2 epidemiologists, this graph. I find it easy to follow, but these are the harm reduction trips for anywhere other than home. So one of the things that disturbs me about the idea of phases, and this occurred even in New Zealand. Phases don't change any of this. And when my interpretation of home is the bubble. And So let's start with your household bubble, and then I'll tell you how I've worked on expanding bubbles. The mask, distancing, clean hands, fewer people, good ventilation, keeping interactions brief. People are arguing now that perhaps we don't need to be worried is about touching things other people have touched, but to me, it's generally good practice. So this line is the risk of transmission, and it shows at home with your family is lowest risk. Walking, running outdoors, 6-foot distance is next. Any group gathering outdoors, even with masks, and then anything indoors. And then the way I think of community transmission rates is it raises and lowers this line. Then I was thinking about what are the factors that say make a group gathering outdoors more or less risks. And I've got here what I've interpreted as lower risk versus higher risk, like masks, or whether there's 6-foot distance, fewer people or more people, the less time, the more time, talking, singing, shouting, and the community transmission rate. And incidentally, behavior change has nothing to do with how smart one is and how much one knows. Example, my own staying in H for 20 minutes in a very crowded, uncomfortable situation. And I've had some people I know say, well, I was at an outdoor coffee. I had it with a friend. Oh, I know the friend well, and I was 3-foot distance, and we didn't have masks. Well, the question is that person in your bubble? If they're not in your bubble, I don't care how well you know them, you don't know their behaviors if you haven't asked, which is awkward to do. And if they're not in the bubble, the general rule is 6-foot distance with masks. If you're talking, even outside, without masks, you're spewing forth particles. A researcher estimated from data that, say, if you're talking indoors, you spew enough to infect somebody with the virus by talking in 5 minutes. And that's, I don't know if that's with or without masks, but the way I think of masks think of being in a room with smoke, people smoking. How much is that going to protect you? You're going to smell the smoke through a mask. And so masks are not perfect. And then indoors is generally the dividing line where it's the more time you spend, the smaller the space, the worse ventilation, irregular sanitizing, it's problematic. And I thought, for me, one of the skills I think that is important here is risk assessment, because it's not black or white, and everybody is trying to assess risks in different ways. So one of the ways I've approached bubble conversation, as opposed to thinking good, bad, right, or wrong, it's what are the risks you're willing to live with and you live with. So I put some examples here. Lower risk indoors is grocery store. It's a large space, limited time, masks. You get in and you get out. I go at an early time, less people, fewer times per month. Lowers your exposure to the virus. Here's what I consider high risk: a hair salon, especially if there's more than one customer at once. So I've had some people in my bubble go to a hair salon at 5 a.m, no other people, good ventilation. And I had to think about it. I said, okay with that. Going indoors with the restaurant, I wouldn't do it. And I've read a bunch of epidemiologists who say, wouldn't do it. A work conference room with recirculated air. The biggest problems I understand in skyscrapers and in work settings is HVAC systems, air recirculation systems are not good for getting air and exchanging it. Now I'm considering going to the dentist, and they have, I'm a little more worried about that with the higher transmission rates right now. In the community, they do keep plexiglass between each room. There's no waiting room. Everybody wears masks, and they have this special recirculation units that recirculates 100% of the air in 14 minutes. So those are considerations. So in approaching these bubble conversations, I first had to say, explain what a bubble is. And then I tried to think of a shorthand way of talking about this. And one is that anybody who has not had a formal bubble conversation with everybody in the bubble is not in the bubble, even if they're a family member. So, for example, there was somebody who had in our bubble who had a daughter inside the house with masks for a few minutes, but that daughter was not in the bubble, and that's a concern. And the question is, do we quarantine from the rest of the bubble for 2 weeks, or do they? So, one is, how do you know somebody's in the bubble? The next is the basic idea: if you're in the bubble. If you're not in the bubble, it's 6 foot distance masks outside. Inside is a hard dividing line. I don't know what we'll do in the winter. And the smoke analogy has helped. And I already can see these conversations don't happen just once. They have to happen repeatedly. The other thing that I've tried to do is I think that it's human to make mistakes. I try to be open about that. And I try to help build an environment where we let each other know, hey, I was outside and I wasn't 6 foot distance. What do we do? And it's really hard because I may end up deciding, well, that may be okay with you, but I'll be quarantined from you or the rest of the bubble for 2 weeks. Again, trying to take judgment out of it, right or wrong. It's okay, this happened, now what do we do? And it's not like usual life where you plan something and you may have some excitement about it, but then this dictates some hard decisions. I will conclude by saying my experience is this is really, really hard. And it's not pleasant. I don't like it at all. The idea of I've got something planned and then somebody did something like they were outdoors, 3 foot distance. Do we change this, particularly if it was important to people? And we can be dealing with this for years. And I think the difficulty I get, again, a large portion of the difficulty I blame on our political environment that is unable to marshal the leadership to help us. It'd be so much better if we had a sense of solidarity about it. So I'll stop here. And as I said, I'm open to, I'll let Reed generate discussion, questions, disagreements, different ways of handling things. I'm interested in what people do differently or new ideas, whatever comes up, I'm interested.
Well, I find the idea that you were expressing that it's not right or wrong, it's a risk assessment. And so you recognize what you're comfortable with and what your bubble is comfortable with in terms of exposure, but that you thoughtfully consider that transmission challenge. So, for example, at the senior center, we're starting to do some activities here, and some of them are inside, but we are trying to separate people. So only have one person in the thrift shop at a time, or we've resumed the foot care with the folks who do the foot care. People really appreciate having their calluses and toenails, get some help with that. So we've adopted things like distancing, ventilation. We're doing it inside, but we're using a big room with fans and open doors, and everybody's wearing a mask and everybody's sanitizing. And we're trying to institute for all of the activities here contact tracing, so that if something were to happen, we could immediately let other people know that they were in the vicinity of an exposure. But obviously, for each person, that may or may not be a suitable a risk for them. So that's the challenge. I wonder if you could talk a little bit more about that idea of risk assessment.
So yes, I don't think it's something we do ordinarily. And I do not think, having been in the medical profession for 30 years, I don't think the medical profession nor doctors have helped us learn that.
Just a second, please. I'm muting Richard because we're hearing a lot of background noise. I'll tell you, Richard, if you have a question, we'll call on you next.
So, so I tend to feel a responsibility, like if somebody in my family, like Madeline, you said you were going to the hair salon. I've had people in my family say that, and I go, "Oh God, I don't want to make them feel uncomfortable, like they're wrong. If you want to take the risk, but then do I ask questions? Because I know how hard it is for me to ask questions. Like if I'm going to the dentist, tell me what you do. What do you do about ventilation and stuff? Because you feel like you're grilling people. So I've asked people, what do you know about this hair salon? And like my daughter-in-law went to the hair salon. And I asked her, well, what do they do about ventilation? Are you going with, are there other customers going to be present? And if she said they were, I would say what I think, but that's up to her. But it might stress me. It's stress because I would be worried about her saying there's other customers present. Then I have to decide whether I'm going to be in her bubble for the next 2 weeks.
Well, I
I'm
did
not want to ask those questions. So I'll stop here.
I did feel like you, and I did investigate, and we don't wait inside. You wait in your car. You're notified when you can come in. There's plexiglass. It's only literally 1 or 2 people in the whole room. All the windows are open, and there is ventilation. And she wears a shield, and a mask. I wear a mask throughout the whole thing, and yeah, it is definitely something I've thought about, and there are maybe other salons, since I know this place and have gone there for so many years. I feel a little more comfortable because I know who she is and what her activities of the day is pretty much. However, definitely it is something to think about. And yeah, it's a hard decision to make. And yeah, so I get you for sure.
Yeah, and Madeline, so if you were in my bubble, I would go, well, I'm a little uncomfortable, but we'll stay in the bubble. You've really addressed that, and and I'd personally be comfortable with the precautions that you and they are taking, but maybe not everybody would. I don't know.
True. Yeah, it's such a personal matter, actually.
Yeah.
Yeah, and I personally really don't like a lot of people wherever I'm at, whether it's inside or outside. And so I try to totally avoid crowds, or not even crowds, but just numbers that are too many, too many to encounter. Yeah. So thank you for your presentation.
Richard has a comment, I think. Richard, can you unmute yourself and share your comment?
Yes, I have 2 comments. First of all, the basic thing is that reviewing the latest information, it is still clear that the scientific and medical community is very uncertain about all of the implications about how this microbe is transmitted from one person to another. And they keep on changing back and forth. The second thing I would like to bring up to the group is my own personal opinion regarding risk assessment as it relates to other people based on my own behavior, that of family members I know very, very well, that of the most professional people I have ever worked with in my career. And my conclusion is we all, regardless of how great our intention is to follow these rules meticulously, make numerous mistakes every single day. Therefore, as I go back to my point number 1, the risk of transmission at this point in time is incredibly high, even among those in the smallest of your bubbles. That's what I would like to contribute.
Neil, any comment or?
Well, Richard, I really respect that opinion, and it really does worry me that the transmission is going up. And I go, well, at what point do I say shelter at home? Go back to the household bubble as opposed to expanding. So I worry about that all the time. And I also agree that everything is uncertain about this virus. So whatever I've told you is more the best guess right now. That, I tend to land on things if I hear it from more than one place that I consider highly reputable. But I don't doubt that these things change over time. So
I would think that one example that we might look at is Yakima. So Yakima was a hot spot, had a great deal of viral transmission. And about 30% of the people in the city, in the community, were wearing masks. And everybody, you talked about unified leadership, everybody in the county, including across any partisan lines, started to make it clear that masks seemed to be a good way to stop transmission. The community agreed, and the mask use went from 30 to 75 to 90%, and the viral transmission rate plummeted.
Okay, so I think that's more than anecdotal, especially when we consider the documented statistics of other countries with different political environments and different social mores, that because they are following the rules far better than we ever will, they are doing a far better job, as our speaker just said when he spoke about New Zealand. So it's going to be very, very difficult in this country.
Yes.
Especially then when you add on what is probably going to happen before, during, and after this election.
Well, that does, as Neil stated, pose a challenge to us. I'm wondering if anybody else might want to share how they are trying to maintain distance and ask questions of people that are either in their bubble or if you aren't using a bubble, talk about that.
The only thing I would like to share, and sounds ridiculous, but anyway, I have a friend that I was speaking with who said they'd seen or heard about the video, quote unquote, from Texas with this woman who has said that the demon sperm and the alien and its DNA, alien DNA, that has caused this, and therefore you don't need to wear a mask or any of this kind of thing. She had all these doctors on the video with her saying that was the case. In other words, the absolutely 180 degrees from what Neil's talking about, and totally 180 degrees. I guess my question is, she was not hearing this. She was not hearing the facts like you're talking about. She said, oh no, that's not the case. This is the case. And there are so many people that are like that, what I'm asking, I guess, is how do you confront that?
Well, the social media did shut it down.
Yes.
The president did retweet that.
And there is, as Richard is saying, there is a sort of a conspiracy-minded enterprise going on that makes it very difficult to have consensus.
Exactly.
Reed, you wanted some ways that other people socialize? Well, one of the things that I do is I go to church on Friday and I weed, and a couple other people weed, and we're not weeding together, but we're apart, but we still can talk to each other. And another thing that my girlfriend and I have started doing is we play Scrabble together, but we do it outside on my porch, and I have this 4-foot table, and she's at one end and I'm at the other, and the Scrabble board's in the middle, and we both wear our mask. And I have a drink out there with her, but it has a straw. So that's one of the ways that I can social distance with my friend and still play Scrabble with her. Church services outside, and that's like going to a concert in the park, and we stay about 15, 20 feet away from each other.
And Neil, I want to thank you very much for sharing your conversations with us. Certainly, if you are interested in sharing other observations, Neil, going forward, feel free to reach out to me. We'd love to have you come back.
I'd love to come back. It's always fun to talk to everybody.